everything from prevention to cure, from wellness to wholeness. Your health matters here. Join us this Saturday from 7 a.m. to 8 a.m. on the Glow Health Hour. Your health, your voice, only on Glow 99.1 FM.
Yes, health is wealth. That's how we welcome you to Glow Health Talk with Nigerian Medical Association Ondo State Chapter. And today we're looking at a topic of discourse that differs from that of last week. You know, every Saturday morning at 7 a.m. we bring in guests who knows their onions around peg and around all, to help us dissect some health challenges, some health topics, and of course give us real workable solutions to those issues surrounding the topic of discourse. And today we have another topic, and it's how to care for your liver. Yes, how to care for your liver is what we're looking at today. And we have our featuring physician, is a consultant gastroenterologist, Federal Medical Centre Owo, Dr. Kenechukwu Okonkwo. Glad to have you on the program this morning.
Thank you so much.
Kedu Kodi.
Odima.
All right.
It's a pleasure to be here.
Yeah. So, without much ado, we might have a little bit of a mixed grill this morning, but I'll try as much as possible to translate into our mother tongue. So, because we would want you to also relate to people who only understand our mother tongue or who can communicate better in our mother tongue. So, as much as we speak in English, we'd also like you to, add a little bit of Yoruba language into it.
No problem.
Thank you very much. Ekabo lekasi sórí ètò wa ètò yín ìlera lọ́rọ̀ pẹ̀lú ìbáṣepọ̀ Nigerian Medical Association ti ìpínlẹ̀ Ondo ń bí àti tún ní ẹni tó dáńtọ́ lónìí, àwọn physician tó dáńtọ́ dáadáa tó mú yìí, àwọn ní consultant gastroenterologist Federal Medical Centre ní ìlú Owo, àwọn náà ní Dr. Kenechukwu Okonkwo lẹ́ẹ̀kan sí ẹ̀káàbọ̀ sórí ètò wa.
Adúpẹ́.
Lónìí àwọn ọba ṣe lè ṣètọ́jú liver wa mi really mọ ẹ̀dọ̀ ṣe rí báyìí pé àwọn gan wọ́n tún mọ liver lédè abínibí wa láti ṣètọ́jú ẹ̀dọ̀ wa. Òun náà la máa gbé yẹ̀wò ní òwúrọ̀ ni. Àwọn náà ló máa sọ gbogbo ohun tá a ní láti mọ̀ nípa ẹ̀dọ̀, bá ṣe lè ṣe tọ́jú ẹ̀dọ̀ kó má lè ṣe ìjàmbá sí ara wa. Gbogbo náà ló máa ṣàlàyé fún wa ní òwúrọ̀ yìí. Orúkọ tèmi ni Comfort Ọmọláfẹ́. Ẹ jẹ́ ká sáré dá tọ́mìnà tá bá dé a ó máa yànnàná ohun tá a nílò lórí ètò lónìí. Ẹ má yí kúrò ńbẹ̀, à ń padà bọ̀. Ẹ máa rántí wípé a wà lórí Facebook ní Glow 99.1 FM Àkúrẹ́. Ẹ tún lè gbọ́ wa lórí Radio Garden tàbí kẹ́ ẹ download Glow FM app lórí Google Play Store. Ibikíbi tẹ́ bá wà lágbàáyé tàbí táwọn èèyàn yín bá wà lágbàáyé náà ni wọ́n ti lè gbọ́ wa ní òwúrọ̀ yìí. À ń bọ̀ wá, ẹ má yí kúrò ńbẹ̀. With Nigerian Medical Association Ondo State Chapter, and today we're looking at how to care for our liver, for your liver, for my liver. That's what we're looking at this morning. And of course, Dr. Kenechukwu Okonkwo is very much in the studio to help us dissect this issue. And we'll begin with this. Dr. Kenechi, should I call you Kenechi or Okonkwo? Which one are you?
You can call me Kene Okonkwo, anyone.
Okay, Dr. Kenechi. So, very quickly, which organ in our body, is the liver, and what are its essential functions?
Thank you very much, man. Like I said before, it's a privilege to be here. I greet those people our viewers at home. So the liver is a very important organ. It's like the machine, the engine room of the body. It's just located somewhere on the right aspect, okay? The place you want to call the stomach, we call it the abdomen, just below the lungs, and it's so important for body function. It stores a lot of nutrients like glucose, like vitamins, like minerals, okay? And then it's important for breaking down some of the food we eat, okay? Drugs, even waste products. Okay, and then it's when we have injuries, okay, the reason why those injuries, the bleeding doesn't persist for too long is because it produces certain things called clotting proteins, okay? And then it's important for immunity, okay? Our body's ability to fight infection, okay? So nǹkan tí mo sọ ni pé ẹ̀dọ̀ ṣe pàtàkì fún ara. Ó wà lápá ọ̀tún ní ara. Ara ẹ̀ pàtàkì ẹ̀dọ̀ ni pé gbogbo nǹkan tá a bá ti jẹ ó níbi kan ó máa ń dúró sínú ẹ̀dọ̀ fún ìwúlò wa, gbogbo àwọn nǹkan èròjà tá a bá ti jẹ tó máa ṣe pàtàkì fún ara. Then ṣẹ́rí tí kòkòrò bá wọnú ara ó láwọn nǹkan tí ẹ̀dọ̀ máa ń gbé jáde tá a bá àwọn kòkòrò yẹn jà. Then tá a bá ṣèṣe ìdí tí ẹ̀jẹ̀ ò ní tán lára wa ó láwọn nǹkan tá ẹ̀dọ̀ ń produce tí ò ní jẹ́ ká kí egbò yẹn kẹ́jẹ̀ má tán lára wa. So like I said, so the liver is so important. One more function, it produces what we call bile, what is known as òróòró. And Sherry, when you eat things like fatty food, nǹkan ọ̀rá tó ṣe pàtàkì fára, if you don't have that bile, you can't digest it. So so it's so important. It's crucial to life and livelihood, and we have one liver. We must take care of it. Ẹ̀dọ̀ ṣe pàtàkì fára, iṣẹ́ tó ń ṣe ó pọ̀, and a gbọ́dọ̀ tọ́jú ẹ̀ so that a lè gbé ìgbésí ayé tó dáa.
Ẹ ṣeun gan ni dókítà Kenechukwu. Ẹ yẹ ká tún béèrè lé lọ́wọ́ yín, kí ni àwọn common conditions or diseases that can cause liver problems? The conditions, situations that can cause liver problems, or lifestyle habit, that can cause liver problems.
Yeah, so the liver, there are a number of diseases that can affect the liver. The top on the list are what we call infectious diseases, àwọn kòkòrò, viruses, bacteria. The top on the list is hepatitis B. I'm sure we'll say a little more about that later on. Kòkòrò tó ń pè ní hepatitis B, we have hepatitis C, okay? And then there are other things that can cause problems to the liver. Herbs, agbo, Alcohol is also a big problem, okay? It can cause significant irreversible damage to the liver. Smoking, FIFA cigar, it can also cause problems to the liver. Then there's a new disease, we call it metabolic dysfunction associated steatotic liver disease. Now we can call it fatty liver. So tọ́ra bá ti pọ̀ nínú ẹ̀dọ̀ ó lè fa wàhálà sẹ́dọ̀. Certain drugs, okay, that we commonly even prescribe, apart from herbs, and that's why you may see your doctor, because certain drugs will fa wàhálà sẹ́dọ̀. Okay, having said that, then there are certain things we call autoimmune diseases. Now, there are some soldiers in the body that help to fight infections. Sometimes those soldiers, for reasons we don't completely understand, can fight each other. Okay, and it's common in women. Okay, so ìgbà míì àwọn sójà tó wà nínú ara tó máa ń bá àwọn kòkòrò jà, wọ́n lè bára wọn jà. Okay, so there are quite a number. There are myriad number of things that can cause disease to the liver. These are the more important ones.
Ẹ ṣeun gan ni dókítà, mo nífẹ̀ẹ́ sí bẹ́ẹ̀ ṣe ń bá wa ṣàlàyé lédè abínibí wa díẹ̀díẹ̀ fún àǹfààní àwọn aráalé. Mo tẹ́ bẹ̀rẹ̀ lọ́wọ́ yín, with your experience, would you say that the incidence of liver disease is on the increase compared to old days? And if yes, could it be, what are the factors responsible for it?
Yeah, so unfortunately, yes. The incidence is increasing. One of the reasons maybe because we are looking for it now. So we are seeing more people with liver-related diseases. We are nítorí pé tẹ́lẹ̀ really kọbi ara sí, really fọkàn sí pé wàhálà lè ṣẹlẹ̀ sẹ́dọ̀, but nísìn àárá àwọn èèyàn tó máa wá hospital. So we are seeing more people pẹ̀lú àìsàn ẹ̀dọ̀. Okay. The other thing is that people don't know about problems that can affect the liver, and that's why I'm happy to be here, because, for example, hepatitis B, in this part of the world, we're having more infections, new infections every year, and it's because people don't know that there are certain lifestyles or risk factors that can predispose you to having this liver disease. So it's increasing. I say don't see, you know.
Kí ni àwọn lifestyle yìí gangan? What are this lifestyle that could cause or endanger our liver?
Yeah, so let me start with like I said, I'm particularly
I
passionate
want you
about,
to marry it with the causes.
yes,
of this.
hepatitis B. I won't start with
You
hepatitis
mentioned
B.
yes.
Now, hepatitis B kòkòrò ni tó lè fa wàhálà sẹ́dọ̀, and kòkòrò yẹn is so infectious. Àti kó lè wọnú ara èèyàn is about 100 times more infectious than HIV. Now, you'll be surprised that many people don't know about it. And, you know, it can be gotten through unsafe blood transfusion. Think about lost hospital. If you don't get blood from an accredited hospital, ìgbà míì téèyàn bá ní ìbálòpọ̀ ọkùnrin àti obìnrin, you don't use condoms or things like that. Èèyàn lè kú láti bẹ̀. Okay? A pregnant woman tó bá wà láàrẹ̀, tó bá bímọ, ó lè fọmọ ẹ̀ báyẹn. You know, so that's why they must be screened. If you, for example, ẹlòmíì á fẹ́ ṣe ìkànnà ẹ̀, you can patronize all this. I call them
unprofessional.
Thank you very much. I was looking for the word.
Because there are some certain words you don't have to,
Yes,
just,
yes.
belittle their profession.
Yes, unprofessional. So ó láwọn èèyàn tí ò gbọ́dọ̀ tọ́jú ìkànnà wa for any reason. Okay, this thing must be started. If you go to Loshi, you go to the barbing salon, or you go to make your hair as a lady, and you don't have your clipper, you are not paying attention to what is used. Okay, particularly if they are sharp instruments, then you can contract many of these viruses, particularly hepatitis B. Then there are many quacks, okay, who give injections, you know. And we're not sure how the person preserves or sterilizes the equipment. So these are some of the routes, okay? These are some of the ways. It's very infectious and it's very much with us.
Now, maybe I should begin with English, or I marry both. There have been misconceptions, thrilling hepatitis B, that even if you sit in a taxi or you sit beside someone and you touch your skin, you have a skin contact with someone who has hepatitis B, that you would definitely contract that disease. And or you are in the market, of course, you're having flux of persons, walking and all that, and then you move closer. I want you to expatiate or clarify that misconception, how people can contract this disease, because it end up having adverse effect on our liver. Please do that.
Yes, thank you very much. So that we don't stigmatize, it's important to realize that it's contacted through secretions and blood, okay? So, pé mo ń gbé pẹ̀lú ẹni tó ní hepatitis, pé mo bọ́ lọ́wọ́, no, you are not necessarily going to contract it. Okay. Now, of course, there's a high risk. The reason is that you have an injury. Okay. So that's why we must be careful. Okay. But that doesn't mean that you cannot hug somebody with hepatitis B. Okay. That doesn't mean you need to avoid the person altogether. No. That's not true in any way. It's like we said, it's infectious, but it's not necessarily body to body contact. Okay.
Ṣeun gan ni ìyẹn ni pé kò tábà fara kan ara bóyá ní ọjà bíbí kébì ìyẹn ni pé ká kó àìsàn tí ẹnìyàn ní ọ̀dà. A fẹ́ bèrè lọ́wọ́ yín, kí ni àwọn early stage, how would we know an early stage that our liver is beginning to have problems, that is the early symptoms of liver problems? Pé ó dà pé kíndìnrín ẹni tí ní ìṣòro, kíndìnrín lágbájá tàbẹ̀dò tí ní ìṣòro, kí ni àwọn nǹkan tí wọ́n lè máa rí tí wọ́n á yẹ pé ó dà pé ó nílò láti lọ sí ilé ìwòsàn láti mọ̀ dájú bóyá kíndìnrín wọn ti ní ìṣòro?
So the drawback here is that the liver disease is not easily detected. ọ̀pọ̀lọpọ̀ èèyàn á kàn ní ara mi kàn gbóná díẹ̀, orí fọ́ mi, you know, and that could just be all hepatitis, you know. It's only a little percentage. Níwọ̀nba nínú àwọn tó bá ti ní hepatitis ló máa ní jaundice. Most people just be, and that's why you can't afford to use anti-malarials just as you like, you know, because ìgbà míì ó kàn lè jẹ́ pé ara mi ṣe mí bákan. It could just be that you have hepatitis. So I'm saying that it's not easy to detect. Some people will not know, okay, until the liver is badly damaged.
So we don't have issues of bí akójúwú àbí kí inú yẹn máa dùn yàn àbí kí inú máa rùn yàn, àwọn nǹkan kan wọ̀nyẹn kò sí lára ẹ̀.
And so nǹkan tí mò ń try láti ṣàlàyé ni pé ṣé rí tí ikùn bá ti bẹ̀rẹ̀ sí ń wú, tẹ́sẹ̀ bá ti bẹ̀rẹ̀ sí ń wú, tójú bá ti bẹ̀rẹ̀ sí ń pọ̀n, ẹlòmíì tó bá ti bẹ̀rẹ̀ sí ń bí ẹ̀jẹ̀, ó ti kì í ṣe early stage mọ́ nìyẹn, ó ti wá ara gidi. And tó bá ti dé stage yẹn, of course ìtọ́jú wà fún, bọ̀ kò lè dàbí ìgbà tó bá ṣẹ̀ṣẹ̀ bẹ̀rẹ̀.
Ẹ ṣeun gan ni Dókítà Okonkwo. Ẹ dára tó béèrè lé lọ́wọ́ yín. Are there measures that can be taken at this stage to prevent progression to more severe form of liver failure?
Yes, thank you very much. So prevention first, okay, but screening, okay. So the first thing to ask you and ask myself is, you know, we talk about HIV status, okay. What is your hepatitis B status? As we speak today, less than 1% of Nigerians know their hepatitis B status, and this is fact.
Less than 1%.
Yes. If you ask on the street, so less than 1% of people with hepatitis B know. So Abodo, Los Hospital, go and find out, am I positive or negative? It's very important. So screening is important, okay? In addition to those, we talked about prevention, okay? Some other things you need to be careful. Tattoos, okay? Elumia can look back tattoo become, you know, we always try and avoid, you know, and then circumcision, scarification, one thing very large, you know, you have to be careful, okay? But so screening, very important, okay, for hepatitis, okay? Okay, you need to avoid agbo. You know, I'm sure that many of our viewers will know that these things are not standardized. We want lo àwọn bàbá wa lo omi pa wa gbọ́dọ̀ lo, you know, until we standardize these things. So it's important.
Mo fẹ́ béèrè lọ́wọ́ yín ibi tẹ́ mẹ́nu bà yín torí àti ní guest kan rí lórí ètò yìí tí mo ní láti béèrè. Ǹjẹ́ kó tó di pé àwọn èèyàn dàgbà tó bí 40, 30, 40, 50 and all that. Findings reveal pé tó bá jẹ́ Nigerian ni, ó bá jẹ́ Igbo tàbí Yorùbá, one way or the other àti lo àgbo rí. So àwọn àgbo yìí, ṣé nǹkan tẹ́ ń sọ ni pé ṣé kò ń ṣiṣẹ́ ni àbí wọ́n lò jù òun ló lè fà? Torí a rí àwọn àgbo kan, this is not to, you know, encourage the usage of herbs, but àti rí àwọn àgbo kan tí ẹ pé wọ́n fún wọn ní right proportion bí díẹ̀ tí ara ẹni òun náà dẹ̀ balẹ̀ ó dẹ̀ ṣiṣẹ́, and different bẹ́ẹ̀ yẹn. Even mo kàn fẹ́ allegedly wọ́n ní kódà gan àwọn medical professionals gan wọ́n lò, but in the right proportion. Don't you think that the professionals should, you know, tell people tẹ́ bá tiẹ̀ fẹ́ lo àwọn àgbo yìí ṣíbí kan ní kẹ́ máa lo? Don't you think the narrative should change? You pé ẹ má lo àgbo rárá pé because àwọn kìíní ń ṣiṣẹ́, àwọn ewé àti ìgbò náà lọ fi ń ṣe àwọn oògùn tá à ń lò yìí. What do you make of this?
Lóòótọ́, this is not an attempt to set aside herbs. Ọ̀pọ̀lọpọ̀ nínú oògùn òyìnbó tá à ń lò àtàgbo náà ti ṣe. But even àwọn oògùn òyìnbó tẹ́ bá ti rà ẹ wo leaflet ìwé tó bá wá, wọ́n á kọ pé iṣẹ́ tó ń ṣe lélẹ̀ tẹ́ bá ti lò ó jù nǹkan eléèlé yọ. So it has its own adverse effects. That's where the problem is. Many of these herbs we don't add nǹkan tó wà ń bẹ̀. So we need to have a system where we can, okay, nǹkan tó ń ṣiṣẹ́ gangan nínú ẹ̀ lélẹ̀ portion nǹkan máa lò lélẹ̀. I don't know if you're getting what I'm saying.
Of course.
We're not there. So this thing, it's an uncharted territory. It is better avoided because ẹlòmíì á lò ó lè dàbí pé ó ṣiṣẹ́ o, but ọjọ́ iwájú wàhálà tó máa fà. I get nǹkan tí mò ń sọ. That's what I'm saying exactly.
Okay. Bóyá tá a bá ti ń parí ètò a béèrè lọ́wọ́ yín pé báwo la ṣe wá lè dé bẹ́ẹ̀, báwo ni kí lẹ rò pé ìjọba lè ṣe sí gbogbo nǹkan, because you said we're not there yet, but we'll come back to that. Kí ni àwọn symptoms ní persons? What are the symptoms in persons with more severe form of liver problem and failure?
So ọ̀pọ̀lọpọ̀ èèyàn tó bá ti wá hospital, tó bá ti wá ara wọn gidi, and that's wọ́n wá ikùn á wú, ikùn á bẹ̀rẹ̀ sí í dùn wọ́n, ojú á pọ́n, ẹlòmíì ara ẹ̀ máa gbóná, ẹlòmíì á ti rù, okay? Ẹlòmíì lè máa bì ẹ̀jẹ̀, ó lè máa ya ẹ̀jẹ̀, ẹlòmíì gan ò ní rí tọ̀tọ̀. At that time, we say the liver has failed, okay? About 80% of the cells are dead already. And àfẹ́ dé, àfẹ́ dé ipò yẹn. So it's important as early as possible, okay, that we identify patients who either have this liver disease or are at risk of it, ká ṣe ìtọ́jú wọn.
Ẹ ṣeun gan ni dókítà. Ṣé liver problem yìí, àmọ́ pé tó bá jẹ́ early stage yẹn wàhálà tó wà associated pẹ̀lú ẹ̀dọ̀, tó bá wà ní early stage bẹ́ẹ̀ ṣe sọ, tí ẹ pé ọ̀pọ̀lọpọ̀ ènìyàn tí ẹni mọ̀ pé bóyá wọ́n ní liver problem, àmọ́ pé kí ẹ̀ tí ẹ̀ ṣe lè wà. Àmọ́ tó bá ti di advanced stage tí bóyá ó ti di pé ẹsẹ̀ nìyẹn ń wú, ikùn nìyẹn ń wú, ojú wọn ń bí ẹ̀jẹ̀, ṣé remedy wà? Tó bá dẹ̀ wà, ṣé wà lórílẹ̀‐èdè wa? Tó bá wà lórílẹ̀‐èdè wa, ṣé wọ́n ti ṣe rí tó ti wà successful? Mo fẹ́ kẹ́.
Yeah, so ìtọ́jú àìsàn ẹ̀dọ̀ tó ti wà advanced ó póríṣiríṣi, okay? So there are some ẹlòmíì tó bá ti wá hospital, some of them ẹlòmíì àtọ́jú ẹ̀ and they make good recovery, ara wọn á yá, okay? But for a large proportion, okay, so there are different levels. The ultimate remedy or the most definitive is liver transplantation tí bẹ̀rẹ̀ sí ń ṣe ní Nigeria. Now, of course, steps are underway, ìjọba àti association gastroenterologist wọ́n ti ń parapọ̀, wọ́n ti ń ṣètò bá ṣe máa bẹ̀rẹ̀ sí ń ṣe, but as we speak today àti bẹ̀rẹ̀. So ìtọ́jú wà fún àìsàn ẹ̀dọ̀.
Àwọn ìtọ́jú tí ẹ ti ń ṣe kó tó dé sí, ṣé ó ń lọ pátápátá àbí tẹ́ bá tiẹ̀ ṣe tán ẹni àkọ́ṣe máa live on medication for the rest of his or her life?
Sherry, the liver is a very interesting organ. Now, tó bá ti bàjẹ́, ẹlòmíì lè ní very good recovery. Particularly, let me say, those with alcohol, they tend to do better than those with viral-related illnesses. Ẹlòmíì tó bá ti wá hospital bá ti tọ́jú ẹ̀, it may return almost back to normality. Ẹlòmíì, that's not very common, but ẹlòmíì will have to be supported, And the reason why, and the other thing I should mention is that ọ̀pọ̀lọpọ̀ àwọn èèyàn tó bá ti ní àìsàn ẹ̀dọ̀ ó máa fa jẹjẹrẹ, and when they come in late stage. So díẹ̀ nìkan la máa lè ṣe, and that's why we need to prevent them getting to that stage.
It means that those who have liver problems might end up having cancer. Is that what you're saying?
Yes, a lot of them. In fact, ọ̀pọ̀lọpọ̀ in this part of the world, a lot of them are padà ní jẹjẹrẹ, particularly due to hepatitis B.
Ẹ ṣeun gan ni, kí ni àwọn nǹkan tá a lè jẹ, nǹkan tí a lè jẹ tó lè jẹ́ kí liver wa kó wà ní ìlera tó péye?
Thank you very much. So let's start by saying eat healthy, okay? Eat healthy, eat a lot of fruits and vegetables. As much as you can, avoid agbo, cigar. If tó bá máa mọtí, reduce it to the barest minimum. Now, I also talk concerning once you are approaching 40 and getting older, you must begin to cut down on oúnjẹ tó bá ní ṣe pẹ̀lú ọ̀rá, oúnjẹ díndín. Because we talked about fatty liver, okay? Particularly if you're hypertensive, diabetic, or you have what we call dyslipidemia, ọ̀rá pọ̀ ti pọ̀ nínú ara ẹ̀. The reason is because tí ọ̀rá bá ti pọ̀ jù nínú ẹ̀dọ̀, it can progress ó lè di cancer yàtọ̀ sí yẹn gan ó lè fa àwọn other complication bíi stroke àti heart failure study ti sọ fún wa pé tọ́ra bá ti wà nínú ẹ̀dọ̀ ó lè tìyàn sáwọn irú kinní yẹn.
So Enika, eat healthy.
Eat as much healthy, but as you approach 40, you must cut down on a lot of refined cocoa and all of that.
Canned
Yes,
drinks.
processed food.
Okay.
You more fruits and vegetables. So at therefore you must intentionally have it in your diet.
No jojumo.
Yes. If you are on the big side, you must reduce your weight. A bit of much exercise. These are important strategies that have been shown to improve the liver health.
So ìyẹn ni pé tí a bá rí pé ẹnìkan kan bóyá health weight ẹ pọ̀ jù kó reduce ẹ tó bá ti súnmọ́ 40 tá a bá dẹ̀ tún rí pé àbá láwọn mìíràn tó yẹ pé Yorùbá máa ń sọ I wouldn't know if you understand pé ẹja gbígbẹ kọ́ lè dín meaning àwọn míì lè lẹ̀pa tí wọ́n lómi lára rárá tí ń weight wọn dẹ̀ tóbi tó pọ̀. Am I right or wrong?
No, you're totally right.
So, irú àwọn yẹn báwo lọ ṣe fẹ́ mọ̀? Okay, you suggest skinny advice? Don't let me put words here. Báwo lọ ṣe máa mọ̀?
I don't want to go into the specific, but what is important is that tó bá tiẹ̀ tí ń pé 40, you must do regular ultrasound. Why ṣe photo inú? You should do it at least every year because ẹlòmíì gan tóbi báyẹn. There's something we call lean muscle, okay? Fatty ọ̀rá bá ti kójọ pọ̀ sínú ẹ̀dọ̀ wá fa wàhálà. So my point is every year, as you get older, you need to do an ultrasound. Just look at your liver. Chora wa ambe. Because some people may be fat, wọ́n lè tóbi. Kọ́ra má kójọ pọ̀ síbẹ̀. It's not straightforward, okay? So tọ́ra bá wà ambe, then you have to take more intentional steps, okay, in terms of your diet. In terms, and of course, like we said, thing about ìfúnpá gíga àti ìtọ̀ sugar, those ones too are risk factors that have to do with fatty liver.
Ẹ ṣeun gan ni mo fẹ́ tún béèrè lọ́wọ́ yín bóyá ká dé dátọ́ mi náà ẹ jẹ́ ká kọ́kọ́ béèrè lé healthy living, healthy diet. Kò ń ṣe gbogbo èèyàn mo rò pé ẹ mọ̀ pé not everyone can afford 3 square meal and àwọn kan wà débi pé any can include fruits, vegetables. Is it just any kind of fruit or specific kind of fruit? Because there are some fruits, healthy fruit actually, that would increase your weight and all that. Ṣé tá bá fẹ́ jẹun ká máa jẹ oríṣiríṣi bóyá tá bá ti rí mango or tá bá ti rí pineapple or tá bá ti àwọn ká máa jẹ pineapple torí ẹlòmíì pineapple ló like ká máa jẹ lọ lójú sometimes these things might have adverse effect. So, I want you to be very specific because we all want to protect our liver. And àwọn èèyàn ń gbọ́ wa nílé torí àwọn tó ṣojú òpó sílẹ̀ sí àwọn èèyàn máa pè wọlé. Mo fẹ́ ká mẹ́nu tó àwọn nǹkan kan. So when they ask questions, it's just going to be for clarifications. So we must have, touch out some issues, areas that pertain to human beings. So what would you say regarding that? What would you say to that?
So on a general note, okay, taban sọ̀rọ̀ nípa èso àbí ẹ̀fọ́, generally speaking. Now there's a category of patients and about ìtọ̀ sugar that they may need to be a little more careful, okay, with fruits that have a high calorie value, or, maybe pineapple, and the like. But generally speaking, okay, and we're fortunate as part of the world, at least we have access to fruits, certain fruits that are seasonal. So I'm just trying to encourage as you get older to ensure that you have some fruit in your diet. It's very helpful.
Ẹ ṣeun gan ni dókítà ajẹ́ka dátọ́ mi náà ìlera lọ́rọ̀ náà lẹ́ṣẹ̀ gbọ́ lórí ìkànnì alálùbáríkà yìí Glow 99.1 FM tàtàkùmọ́ lẹ́sàdúgbò ìjọpọ̀ àdúgbò ìjàpọ̀ nílùú Àkúrẹ́ ń bí ẹ má yí kúrò ń bẹ rántí pé wà lórí Facebook just in case you have questions for us you may drop your questions under the live streaming session. We're on Facebook at Glow 99.1 FM Àkúrẹ́. Please stay tuned. lọ́rọ̀ pẹ̀lú ìbáṣepọ̀ Nigerian Medical Association ti ìpínlẹ̀ Ondo ń bí adẹ̀tínbá dókítà Kenechukwu Okonkwo sọ̀rọ̀ Kenechukwu in full but èmi like àti máa Kenechukwu so that kò ní gùn kò dẹ̀ ní kọ́ wa lẹ́nu. Ẹ káàbọ̀ padà à ń sọ̀rọ̀ bó ṣe lè tọ́jú ẹ̀dọ̀ inú ara ènìyàn wọ́n dẹ̀ ń tà sọ kó tó di pé adátọ́mi ẹlẹ́ẹ̀kan ni pé wọ́n ní ká máa jẹ èso dáadáa pẹ̀lú ẹ̀fọ́ ní ojoojúmọ́ kò kàn ṣe pé kakọ̀ máa jẹun ohun tá a bá ti àwọn èso wọ̀nyí wọ́n ní àwọn kan wà tẹ́ pé àkókò kan la máa ń rí wọn sáwọn kan tá a bá ti ń rí lákòókò kan yẹn jẹ́ ká máa fi sínú oúnjẹ wa ẹ ṣeun gan ni wọ́n mọ̀ pé ìjọba lè ń bá ṣiṣẹ́ dókítà wa mo tẹ̀ lérò pé àwọn ìbéèrè kan tó fẹ́ bí yín báyìí bí a kò ní bí yín nínú púpọ̀ jù ok ẹ dẹ̀ lè fún wa ní ìdáhùn tó yẹ. Kí ni àwọn ìjọba ń ṣe torí kò ń ṣe gbogbo mẹ̀kúnnù náà ló lówó débi pé wọ́n lè treat àwọn liver problems wọ̀nyí àdèmọ̀ pé oríṣiríṣi health scheme ló ti wà fún àwọn ènìyàn tó jẹ́ pàápàá jùlọ ìpínlẹ̀ Ondo ń bí àwọn ọmọ ìpínlẹ̀ Ondo pé láti jẹ́ kí health care wà affordable fáwọn èèyàn káwárí senior àmọ̀kó wà òkè lọ́jọ́ kankan sọ pé àwọn senior kankan àwọn tó ti ní liver problems wọ̀nyí mélòó nínú ẹ̀ ni ìjọba ń ṣe fún àwọn ènìyàn lọ́fẹ̀ẹ́ ṣé ìtọ́jú wà fún àwọn mẹ̀kúnnù tí ò lówó láti lọ́fẹ̀ẹ́ àbí subsidized amount kí ni ìjọba ń ṣe láti ran àwọn èèyàn lọ́wọ́ láti tọ́jú liver wọn o láti ṣe ìtọ́jú liver wọn kí ni nǹkan tó ń ṣe.
Ẹ ṣé àdúpẹ́ mo ń ṣiṣẹ́ níjọba hospital ìjọba but I can say a little about certain strategies in place, okay, because mo mọ̀ pé Association of Gastroenterologists àti ìjọba wọ́n ti parapọ̀ a lot of policies in terms of bá ṣe máa ṣe ìtọ́jú hepatitis B. I know for certain ní Ondo State, I know that the governor and the special advisor on health, I know there's a framework for hepatitis B. In fact, ìgbà kan wọ́n ti pín oògùn hepatitis B lọ́fẹ̀ẹ́. I'm very much aware of that Ondo State. So the government is doing its best. Of course, ìjọba wọn láti ṣe, there's still a lot to be done, but I can see that the government is trying to make some inroad in terms of care. Mo dẹ̀ mọ̀ pé
a ní ìpè kódà àìtí sí ojú òpó Islam àti nẹ́tẹ̀kọ́ tó fẹ́ pọ̀ wọlé. Hello, ẹ káàárọ̀.
Hello.
Ẹ káàárọ̀, kí lorúkọ yín? Hello, ẹ káàárọ̀, kí lorúkọ yín? Hello, ẹ ti wọlé o.
Yálóde.
Kò ń ṣe Yálóde níbí ìbí ẹ ti mix ẹ̀ mọ́ra wọn. Please continue.
So at least mo mọ̀ nípa nǹkan tó Ondo State ìjọba Ondo State ń ṣe nípa díẹ̀ tán lè ṣe. Of course àyè wà ká lè tún ṣe púpọ̀ nípa kòkòrò yẹn. Mo dẹ̀ mọ̀ pé ìjọba the federal government they are trying to put something to get respect to treatment of hepatitis carcinoma. Okay, but of course àwọn yẹn and then they're also working on vaccination, okay? Because I mean, part of the preventive strategies are better Gesara for hepatitis B. Now I know it's not free yet, but I know there are certain things in the framework, you know, Nempa better Gesara hepatitis. Before you new, okay? So those are some of the things I'm aware of, okay?
Nípa ẹ̀dọ̀ gangan ṣé ó níbi tí ìjọba ti ń ran àwọn èèyàn lọ́wọ́ àbí tí wọ́n dá maybe center kan sẹ́ pé gbogbo ẹ̀yin tí a bá ti ní liver problem tó ti di pé stage yẹn ti wà critical bóyá owó yín ò tó ó kẹ́ lọ bí báyìí kẹ́ ẹ ṣe lọ́fẹ̀ẹ́ tàbí àfún yín ní ìdíwó lé lórí àbí nǹkan kan yẹn gangan mo fẹ́ kẹ́ ṣàlàyé fáwọn ẹ̀ torí ẹlòmíì tó ti ní àìsàn yìí tàbí tó níyàn tó láìsàn àbí tó mú èèyàn tó ní àìsàn yìí wọ́n dẹ̀ ń gbọ́ wa lọ́wọ́ wọ́n fẹ́ mọ nǹkan tí ìjọba ń ṣe láti ran àwọn èèyàn lọ́wọ́ nípa àìsàn yìí.
Okay, so mo sọ̀rọ̀.
Yàtọ̀ sí fúnfúnni lóògùn bó ti dé critical stage kí ni nǹkan tó ń ṣe.
Yeah, so ṣe mọ̀ pé mo ń sọ̀rọ̀ nípa liver transplantation mo ní ìjọba àti Association Gastroenterologist wọ́n strategize. Now I don't know mi wàá mọ̀ bóyá wọ́n subsidize but à ń try láti wo bóyá máa ní center kan ní Nàìjíríà tá bẹ̀rẹ̀ sí ń ṣe transplantation, which means that tẹ́lọ̀ bá ti bàjẹ́ dé stage kan wọ́n lè yọ díẹ̀ kúrò lára ẹni tó wà healthy, tó wà normal. I mean, because it's very cost intensive. I don't know, but I know that gbogbo àwọn kìnìún náà wọ́n yìí ń sọ̀rọ̀ nípa ẹ̀, trying to see if they can chart a way forward.
Ẹ ṣeun gan ni nípa health wa ṣé rò pé ìjọba ti ṣe tó àbí wọn ò ṣe rárá àbí wọ́n ti ṣe kọjá yìí?
And Sherry, when it comes to health, apart from the fact that it's personal business, I think that government has a lot to do, so much more to be done. Okay, I won't say that. I won't give them 100%, but I think in this part of the world, implementation is always the issue. Amani plan, so but we need to
Amani paperwork.
Yes, but we need to get on ground and do a lot of work, and. So we're working. I believe that there's work in progress.
Ẹ ṣeun gan ni numbers àkókò tí tó fẹ́ yàn wọ́n ara lé láti darapọ̀ mọ́ wa. Ǹjẹ́ ní ìbéèrè kan tàbí méjì láti béèrè lọ́wọ́ dókítà wa? Àwọn numbers tẹ́ máa pè náà ni 0805 551 1110. Máa pè lẹ́ẹ̀kan sí 0805 551 1110 tàbí 0706 677 1822 0706 677 1822. Àwọn numbers méjì náà lè pè láti darapọ̀ mọ́ wa ní òwúrọ̀ yìí. Ẹ má yí kúrò ń bẹ̀, ìkànnì lálùbáríkà náà lẹ ṣì ń gbọ́ Glow 99.1 FM. Ètò 30 náà ní ìlera lọ́rọ̀ pẹ̀lú ìbáṣepọ̀ NMA Glow Health Talk with NMA. Please stay tuned. Kí lorúkọ yín bolẹ̀ tí ń pè wá?
Ẹ káàárọ̀.
Ẹ káàárọ̀, à ń gbọ́ yín. Kí lorúkọ yín bolẹ̀ tí ń pè wá? Hello. Oda ẹ máa pè wá padà. Lérò pé bóyá wọn gbọ́ wa dáadáa máa wà ń gbọ́n. 0805 a gbọ́ yín dáadáa o. Oda rí pẹ̀lú mi tí ń pè wá wọlé. Hello, ẹ káàárọ̀.
Ẹ káàárọ̀.
Ẹ káàárọ̀, kí lorúkọ yín bolẹ̀ tí ń pè wá?
Mo ń pè láti àdúgbò Ìjọ̀ká. Ìyá àbèjì lórúkọ mi o.
Oda ìyá àbèjì.
Nǹkan tí mo kàn fẹ́ béèrè lọ́wọ́ yín ni pé irú àwọn èso yẹn tẹ́ ní kí dókítà ṣàlàyé fún wa tó wúlò yẹn wọ́n ṣàlàyé ẹ̀ àgbọ̀n wọn dárúkọ ẹ̀ fún ẹni tó bá ti rí tí ò bá fẹ́ ní liver problem yẹn wọ́n dárúkọ àwọn èso yẹn.
Oda ẹ ṣeun gan ni wọ́n ti gbọ́ náà bẹ́ẹ̀ wọ́n á dáhùn ìyá.
àbí tó lè damage àwọn liver yẹn.
Oda
bẹ́ẹ̀
ẹ ṣeun gan ni ìyá àbèjì. Ẹ ti gbọ́ ìbéèrè ìyá àbèjì. Ṣé wọn kí mo béèrè lọ́wọ́ yín lẹ́ẹ̀kan àwọn èso yẹn dárúkọ àwọn èso tó yẹ ká máa jẹ, èso ìta máa jẹ àti tó yẹ pé tá bá jẹ ó lè affect kidney wa. Wọ́n lè jẹ́ méjì ibi mẹ́ta kankan èyí tó dáa àti tí ó dáa.
So bí mo ṣe ṣàlàyé tẹ́lẹ̀ mo ní kò sí gbogbo èso tá à ń jẹ normally gbogbo ẹ̀ ló máa wúlò. Mo kàn ní pé ṣẹ́rí àwọn tó bá ti nítọ̀ ṣúgà ó lè àwọn èso tó bá ti dùn jù wọ́n láti yọwọ́ kúrò bẹ́ẹ̀ bọ̀ kò séso tá à ń jẹ ní ìlú wa yìí ládùúgbò wa tí ò wúlò fún ara fún ẹ̀dọ̀ pàtàkì.
Ẹ ṣeun gan ni dókítà wa mo lérò wípé ẹ dárúkọ àwọn fẹ́ dárúkọ àwọn.
No, okay.
Torí àwọn èèyàn yẹn gan iṣẹ́ mọ̀ oríṣiríṣi èso okay ẹja gbígbé yìí bí a kà fún any time kẹ́ process àwọn èso wọ̀nyẹn. Hello, ẹ káàárọ̀. Hello. Ẹ ti wọlé o.
Hello, yeah.
Yes, ẹ káàárọ̀. Hello, you there? Good morning. Ó dáa bóyá wọn rí lónìí àmọ́ àwọn gbọ́ yín gbà tẹ́sọ yé àyìn o kẹ́ padà pè wá bóyá ojú òpó yẹn ni ò jágere dáadáa 0805 551 1110. I'll take that again. 0805 551 1110 or 0706 677 1822. Ìtẹ́bá pẹ̀ tẹ́bá rí pé ojú òpó yìí ò jágere tó lè padà pè wá sórí network mìíràn. Yes, dókítà Kenechukwu àti padà sórí sọ́dọ̀ yín. Àwọn èso yẹn wọ́n ní kẹ́ ẹ dárúkọ. Ṣé mo pé mo bí ẹ̀ méjì ni mo béèrè ìbéèrè yẹn àbá mo rí pé bóyá ẹ kọ̀ wípé ó yẹ káwọn èèyàn mọ èso yìí náà kò nídìí kí n máa túnṣe máa dárúkọ bóyá àgbálùmọ́ àbí kankan mo fẹ́ kẹ́ dárúkọ àwọn èso ẹ rí pé èèyàn kan ti pè so mo fẹ́ kẹ́ dáhùn ìbéèrè ìyá àbèjì tó pè láti ìjọka ẹ̀.
so kò sí èso tí ò dá ọsàn àgbálùmọ̀ bẹ́ẹ̀ ṣe dárúkọ pineapple apple
watermelon
ikàn kò sí èso tí ò dá and ọlọ́run dẹ̀ ti bless wa kò sígbà kankan nínú ọdún tá à ní ìrẹsì.
hello ẹ káàárọ̀ kí lorúkọ yín.
ẹ káàárọ̀ sà ẹ káàárọ̀ mà.
ẹ káàárọ̀ sà kí lorúkọ yín o.
ní rural area ṣé ẹ gbọ́ wa.
bẹ́ẹ̀ ni à ń gbọ́ yín kí lorúkọ yín.
rural area àìsàn liver problem.
ẹ sọ orúkọ yín ẹ ní
wọ́n ní ìlú ńlá ó kọ́ mọ̀ ẹ jọ kí ló fà á God bless you.
ẹ dárúkọ orúkọ yín kí lorúkọ yín.
orúkọ mi ni Mr. Olú láti Ìjẹ̀bú Àkúrẹ́.
ó dáa ẹ tún ìbéèrè yín béèrè lẹ́ẹ̀kan sí.
ní rural area ṣé ẹ gbọ́ mi.
bẹ́ẹ̀ ni.
àìsàn liver problem kò wọ́pọ̀ ńbẹ̀ ṣùgbọ́n ní ìlú ńlá ó wọ́pọ̀ kí ló fà á.
ẹ ṣeun gan ni wọ́n á dáhùn ìbéèrè yín. ṣé ẹ dáhùn ìbéèrè Mr. Olú.
ẹ ṣe sá so well wọ́n ní kò wọ́pọ̀ ní rural area well maybe not but ṣe rí bí mo ṣe sọ awareness ń pọ̀ sínsìn àwọn èèyàn ti ń mọ̀ ẹlòmíà ní ọ̀sà ló ń dà mí láàmú meanwhile ẹ̀dọ̀ ni wàhálà yẹn ti wá so information ti ń jáde àwọn èèyàn ti mọ̀ pé nǹkan ti ẹ̀dọ̀ lè láìsàn ẹ get now but ẹ má gbàgbé bá ṣe sọ tẹ́lẹ̀ àní nísìn àwọn kòkòrò ẹ̀dọ̀ yẹn àwọn kòkòrò tó lè fa wàhálà sẹ́ẹ̀dọ̀ they are on the increase. We are beginning to more risky lifestyles. Getting then àwọn èèyàn ń lo yàtọ̀ sáwọn àgbo tá à ń sọ̀rọ̀ there are many other drugs we call psychoactive drugs Indian hemp marijuana àwọn èèyàn ń lò sí àwọn èèyàn mọtí sí so these things are definitely on the increase.
ẹ ṣeun gan ni a ti ní àwọn ìbéèrè kankan tá a fẹ́ béèrè lọ́wọ́ yín a dẹ̀ lérò wípé fún àǹfààní kúkúrú ta ní ẹ lè dá wa lọ. Is fatty liver disease reversible?
Oh, very much reversible at the early stage, okay?
Nìkan.
So at the early stage, but bí mo ṣe sọ mo ní ẹ̀dọ̀ is a very interesting organ. Ẹlòmíì tán bá tọ́jú ẹ̀ the body it will heal fast ẹlòmíì but like we have mentioned early detection is important so ẹlòmíì tó bá ti ní fatty liver tó bá wá sí hospital bá ti bẹ̀rẹ̀ sí tọ́jú ẹ̀ tó bá bọ́ sí wa létí it can be reversed.
àmọ́ ní tí o bá ti jẹ́ early stage nǹkan tẹ́ pé ó ti pọ̀ torí mo gbọ́ nígbà kan tẹ́ ní wọ́n máa mú ẹ̀dọ̀ pé ó wà very expensive kò dẹ̀ sí ní Nàìjíríà wọ́n máa mú ẹ̀dọ̀ èèyàn tó dáa wọ́n á mú lára ẹni tí ò dá wọ́n á fi mọ̀ kó lè wà okay ìyẹn ó ti dé critical stage regardless tẹ́ bá ṣe surgery tẹ́ bá ṣe ó wà reversible tó even tó kó má yẹ pé ó ṣe nìyẹn kó ti dé critical stage kó má jẹ́ all semi critical stage tó o bá ṣáà tí mú ẹ̀mí lọ tí ẹ̀mí ṣì wà tí wọ́n dẹ̀ ń struggle pẹ̀lú ẹ̀mí yẹn torí liver torí fatty disease liver or fatty liver disease ṣé ó ṣì wà reversible mo fẹ́ kẹ́
yes so bí mo ṣe ṣàlàyé tẹ́lẹ̀ in the early phase téèyàn bá ti lọ́ra nínú ẹ̀dọ̀ ìtọ́jú lè wà fún but even at the critical stage ó láwọn oògùn téèyàn lè lò at advanced stage of course because we don't ní liver transplantation nílùú yìí at the moment so àwọn tó bá ti wà particularly advanced báyẹn a lè má lè help any at that stage okay but and that's why we're emphasizing for now ní Nigeria that at the early stage you need to know what is happening ẹ tètè wá gbà tọ́jú so that you can enjoy a good quality of life.
Thank you very much. Can young people develop liver disease?
Why not?
Why?
Yes, so
how?
Yes, so young people, in fact, in this part of the world, Africa, Nigeria particularly, most people that are real hospital are relatively young, ẹlòmíì in their 40s, okay? Because kòkòrò tó máa ń sábà fa liver disease àti kékeré láti máa ń kó. Adẹ̀wà ń bẹ adákẹ́ our mama ba edoyenje dear. It's a get. Okay, and then we're talking about risk factors now. Ọ̀pọ̀lọpọ̀ èèyàn, they're on drugs, you know. So there are a lot of young people we're seeing today. Ẹlòmíì mọtí, you know, and you know, in large quantities. Ó dẹ̀ lè fa wàhálà sẹ́dọ̀. And then I want to say about women particularly, because we talked about autoimmune diseases. And autoimmune diseases ó mean pé ara ń bára ẹ̀jà for reasons tí ò yé wa. Now, you know, ó lọ hospital ó tọ́jú malaria lénìí. And then after 1 or 2 weeks, you're still having those symptoms.
Again.
Yes. You know, then you should see a doctor and say, look, take a look at me, because some young ladies will come down with autoimmune liver disease. Ìyẹn wọ́pọ̀ sàn sí àwọn obìnrin, okay? So young people can have liver disease.
All right.
Particularly in this environment.
Eshungani, how can we prevent hepatitis infections?
Yes. So the first thing is information. You need to go and find your status. And that's a lot. And there are many places where you can test yourself. That's not a death sentence. It means that if you are negative, hospital
tíyàn bá ti wà negative already, so abẹ́rẹ́ wà tá a lè gbà tẹ́ pé kò ní jẹ́ kẹ́niyẹn ní rárá.
It's gated. That's it exactly.
ṣé ọ̀fẹ́ ni àbí wọ́n máa san?
No. I think it's very cheap.
Kò wọ́n.
And there are 3 doses. It's important to state that abẹ́rẹ́ àjẹsára ìyẹn láti gba ẹ̀mẹ́ta lèèyàn máa gbà. Okay. The one at day 0 or day 1, if you like, lẹ́yìn oṣù kan ìyẹn gba ìkejì. And then the 6th month, lẹ́yìn ìgbà téèyàn gba the first dose.
Okay.
So that would be 5 months. The third one, oṣù márùn lẹ́yìn ẹlẹ́kejì téèyàn gbà.
Oh.
Okay. And that vaccine is 95%. Well, 95%. It protects you.
Eshungani, her liver disease is hereditary. Àwọn èèyàn máa sọ pé oríṣiríṣi nǹkan pé wọ́n máa heredity láti bí ìdílé bàbá o, ìdílé ìyá wọn tàbí bàbá àbí ara ìyá. Ṣé ó wà hereditary?
Yes, a small fraction of liver disease are hereditary. A small fraction. So possible kó ti wà nínú family, bóyá nínú family bàbá àti ìyá ìdílé wọn. You know, it's possible, but it's not so common.
What advice would you give Nigerians to protect their liver daily? Kini advice ìmọ̀ràn tẹ́lẹ̀ fún àwọn ará nítorí àkókò tí pọ̀ wà ní kókó mọ́ra pápá mọ́ra báyìí a lè gbà pé kọ́kọ́ mọ́ a lè gbà pé mọ́ fẹ́yìn tẹ́ ń pè wá báyìí ẹ má bínú ọjọ́ mìíràn ẹ lè tẹ text messages wọlé a máa transfer relate ẹ sí dókítà Kenechukwu. So your general advice, you know, to Nigerians on how to protect our liver.
So number 1, a healthy lifestyle. Very important, okay? Let's avoid agbo as much as possible, or tea, cigar, okay? Number 2, you need to go and screen yourself for hepatitis B. Now, momenu by hepatitis B, non for there are other hepatitis,
other things,
yes,
okay.
like C, okay? To le ba edo, yes. Now, but you need to go to the hospital, walk into a lab. I want to know my status, okay? Because and 1 in 12 Nigerians has hepatitis B. Like I said, only about 2% are aware. But less than 0.1% is receiving care. Now, you need to go to the lab. Do I have it? You need to know now, because it's manageable. Okay, and then you avoid, you know, àwọn nǹkan tá a sọ tá mẹ́nubà nípa gbẹ́rẹ́
circumcision.
So, yes, ensure that you do, you know, mo ń tọ́jú economy, mo fẹ́ lọ gẹrun. You need to ensure that when you go to those places, you don't have your own clipper, or you have to emphasize that they wọn á tọ́jú ẹ̀ pẹ̀lú iná. They must take care of it. Okay, you get blood from accredited hospitals. okay? You ensure that those who treat you are proper nurses, okay? Proper injection, all those things are key. Because like we said, we're in an epidemic. More than 20 million people have hepatitis B as we speak, and many of them don't know. One more thing. Olonyo, as a woman, it's a very important place. And many women are benefited, particularly in the teaching hospitals and many of our government hospitals. So when you are pregnant, ensure you go to a proper hospital. Fún baby because you can hand it over to your baby. Those who are possible, only a fún baby TB, so that tí mommy tí mama kúkúrú yẹn fún baby, so that kò ní kúrò baby. So those are the steps by and large we're working at to prevent this transmission of hepatitis, which is a big problem in this part of the world.
And of course, it affects the liver.
Yes.
All right, that's what we can take. Nigerian Medical Association, Glo 99.1 FM, NMA Tipulondombi. Ose Tumbo Lutuda, Pokpatakilawa executive producer, wa Dr. Ezekiel Akonde, ati producer, wa Dr. Komolafe Okpe Toga. And it's Dr. Kenechukwu Okonkwo. Thank you very much for joining us on the program this morning. Until next week when the program returns, remember that your health is wealth. My name is Comfort Omolafe. Bye for now.
If you go pharmaceutical, try balance it with the natural. Some food and no food, it is chemical.